Good evening. Thank you for joining us. The amount of opioids that patients are being prescribed has gone down by some 32% over the past 3 years. That's according to a new report from the state of Wisconsin.
Now, part of that trend may be due to a program implemented in Wisconsin a few years ago that keeps track of controlled substances prescribed to patients. Alexandra Burnley explains.
A pharmacist here at Smith Pharmacy in Little Chute says that he has noticed patients filling less opioid prescriptions over the years.
You can tell there's a dramatic decrease in opioid prescriptions.
One of the reasons for the drop could be because of the Wisconsin Enhanced Prescription Drug Monitoring Program. It keeps track of every controlled substance that a patient is prescribed, like opioids.
The prescription drug monitoring program the state put in place is the biggest reason, in my opinion, because it holds everyone accountable, from the patient to the doctor to the pharmacy. There's a record of everything.
Before the program, doctors and pharmacists couldn't see if a patient had gone around to multiple doctors asking for the same prescriptions. This program closed that loophole.
You would have no way of knowing if they're going to see other doctors for the same prescription, if they were doing doctor shopping or other pharmacies.
Over at Bellin Health in Green Bay, the doctors use the required program, review opioid dosage charts, and compare their prescription rates to other Bellin doctors.
It's allowed them to talk to each other to say, how come I prescribe more than you, or what are you doing, and what alternatives are you using?
While the system has been largely successful at curbing overprescription of opioids, Smith worries that the trade-off is an increased use of illegal opioids like heroin. He sells this Narcan at the pharmacy when customers request it.
I know heroin use, in talking to law enforcement, heroin use has been an increase in the area quite dramatically over the last 5 years.
In Little Chute and Green Bay, Alexandra Burnley, Local 5 News.
Thank you, Alexandra. Both Bellin Health and the owner of Smith's Pharmacy added that not only have they seen fewer opioid prescriptions, but the prescriptions they do see are for shorter periods of time.